conventional medicine has emerged as the leading cause of death and injury in the United States. Instead of lifting up people's level of well-being, the American medical system is now doing more harm than good. Hospitals, which are supposed to be a safe haven for the ill, are plagued with medical malpractice and errors. In 1999, up to 100,000 people every year were at risk of dying from mistakes made in the hospital. 10 years later, that number rose to 180,000. Today, that number could be as high as 440,000 casualties of medical mistakes. Hospitals are also notorious breeding grounds for infections. Every day, 1 in 25 patients in the U.S. gets at least one infection associated with their hospital stay. Nearly 2 million people acquire a hospital infection every year, resulting in 90,000 deaths. The most common infections acquired in hospitals are pneumonia, surgical site infections, gastrointestinal, urinary tract, and bloodstream infections. Antibiotic-resistant infections affect more than 2 million Americans every year, killing about 23,000 and accounting for a staggering $20 billion in annual direct healthcare costs. The conventional medical system has also transformed the U.S. into a drug-dependent nation. Nearly 70% of all Americans are taking at least one prescription drug for a chronic or medical condition. Antibiotics, antidepressants, and opioids top the list. 1 in 5 Americans take at least one psychiatric drug. 1 in 4 senior citizens takes 10 to 19 pills a day and fills over 30 different prescriptions a year. If you add in drugs prescribed for other chronic senior conditions such as GERD, angina, depression, rheumatoid arthritis, and congestive heart failure, that could easily add up to 24 or more drugs a day. Children are being overtreated with medications and vaccines. In fact, they are the leading growth demographic for the drug industry. This growing dependency on drugs is not only putting our health on the line, but is also placing a huge financial burden on our shoulders. In 2012, the U.S. led the world with $328.2 billion spent on prescription drugs. By 2017, that number is projected to be $350 to $380 billion. Who is making money off our so-called need for so many pharmaceuticals? Think about it. The market for pharmaceuticals and biotech drugs is projected to hit $1 trillion in 2014 and will rise to $1.2 trillion by 2017. Americans actually spend more on healthcare than any other industrialized nation, yet it is not notably superior to any of the 12 comparable nations. 15,000 people die every year in the U.S. from overdoses of opioid or narcotic pain pills. Between 1999 and 2010, the number of women who died due to pain pill overdoses increased by a staggering 400%. Even more disturbing is that studies of new drugs introduced from the mid-1970s through the mid-1990s show that only 11 to 15.6% provide any therapeutic gain. More than 1/3 of the drugs were approved on the basis of a single trial, without replication. Many other trials were small, short, and focused on lab values or some other surrogate metric of effect, rather than clinical endpoints, such as death. Even the younger generation is now falling victim to the perils of this system. In a recent study of 29 economically advanced countries, the United States ranks 26th in child well-being. Out of 29 developed countries, the U.S. is 26th in infant mortality, just ahead of Slovakia, Latvia, and Romania. The only countries with infant mortality rates higher than 6 per 1,000 births are the U.S., Latvia, Romania, and Slovakia. Among 29 developed countries, the U.S. surpasses all in having the largest percentage of children aged 11, 13, and 15 who are overweight, a trend that predisposes them to chronic diseases as they grow up. These numbers reflect a health emergency in America.
It's time for you to act now. Stop bombarding your body with medical interventions that only put you in harm's way. Instead, reward yourself with the fit and lean body that comes from clean and healthy lifestyle habits. It's time to take control of your health.